All right, welcome back. It's 11 minutes away from 9 at breakfast. Who would you trust for help with a minor health problem like, say, a tummy ache, hay fever or a nasty rash? The pharmacy or the health supplement store? Well, Dr. Shaun Holt has been researching those very questions and joins us now. Shaun, morning to you.
Good morning, Paul.
Why did you decide to do this research?
Well, just on a whim. I was walking past one of the high street store health food stores and I saw a sign saying free health advice. And I thought, well, you know, these people working in there won't have degrees in medicine or pharmacy, so I thought, well, let's see what that advice is like.
Do we know, or do you know, how many New Zealanders are likely to go to a health food store as their primary health deliverer?
Well, we know it's a lot and we know it's increasing, but of course it's free, there's very nice people in there, and you'd be surprised what major symptoms people will present with in a health food store.
Having said that, the pharmacy is free. You'll get free advice in a pharmacy as well.
It is, and my main message, if you're on the high street and you want a bit of advice, definitely go to your pharmacy for medical advice.
All right, now you gauged, and we don't have the time to go into exactly how you did this, but you gauged the credibility, the worth of the advice that you were getting in both of those, in both the pharmacy and the health food store. How many different health food stores and pharmacies did you canvass?
25 of each.
25 of each.
Yeah.
All right. First of all, the health food stores. What was the advice like?
It was awful. Now, I've got to say, I won't go into details of what we said, but it was barn door. It was really obvious that this was severe, uncontrolled asthma and the person could potentially die. It wasn't subtle symptoms like you'd see on House MD or something like that. And in the pharmacy, they picked it up 25 out of 26 times.
All right, so when you say that it was awful, the advice, was it dangerous? I mean, was the advice perhaps advice which was going to make the problem worse?
Well, the only reasonable advice, in my opinion, would be to, hey, go and see a doctor. I can't treat that. Now, in almost every case, products were sold, and there's no evidence.
Well, which is the whole point
of
it, of
course.
course.
Of course, they're shops, yeah. But only 1/3 referred to a doctor, when everyone should refer to a doctor in that scenario. And an even more striking finding, something we never even anticipated, was that 5 out of the 26 said, don't see a doctor. We can look after you, and they'll only give you steroids, which are bad for you.
So presumably that is in an effort to sell even more stuff the next time the people come back.
Presumably.
Now, the pharmacies, of course, they're in the business of selling stuff as well, but their advice was very credible.
Yeah, and they're also, you know, trained health professionals. They're trained to recognise symptoms. If you present to a pharmacy assistant and it's anything but totally minor, they'll refer you straight to the pharmacist who is trained medically.
All right, so what we've got to say is, from your point of view, I mean, you're a traditional doctor, but you do embrace some things in alternative medicine as well, don't you?
Exactly, if it's based on evidence. I've written a book on it.
So this wasn't about trying to debunk myths or anything like this.
No.
This was just taking New Zealanders and saying, where do you go? Maybe you shouldn't be consulting with these people.
Yeah, for anything at all major, then don't take advice from the high street store. And it's the same in the US, in the UK and in Canada. There's been around 20 similar surveys, all finding that people just aren't getting referred for serious symptoms.
These health food stores, are they misleading people on purpose, do you think?
I don't think so. And again, I don't want to ban or regulate them or anything like that. I just want people to be aware that you know, the advice that you're getting isn't, you know, necessarily the highest. For example, one of the surveys in the States with symptoms suggestive of cancer, the person first day on the job didn't know what to do, rang her mother. And her mother said, oh, give this person vitamin E.
That's extraordinary.
It is, but this is happening.
And quite often in these health food stores, they're saying these are highly trained individuals, but that is, in itself, an ambiguous statement, isn't it?
Yeah, the two major high street stores here make claims that their staff are highly trained professionals, health consultants. Well, you know, they'll have been on a training course, but nothing like a university education.
All right, so your recommendation to people watching now is?
Buy your things from a health food store, very, very minor things you can go for advice there, but anything more than that, go to your pharmacy or ideally your doctor.
All right, Shaun, thank you very much for joining us. Shaun Holt.
It's interesting research, actually. Very interesting.
It's amazing. And it's amazing the number of people who choose to go there and literally are using the health food stores as their primary health provider.